what are the steps hospitals and health systems can take now to reduce testing delays, improve outcomes, and lower the cost of care?
So, one of the things that has been implemented in some systems, and at Quest, it's something that we've been working on, is a pathway type approach where depending on the patient's diagnosis, what is the tumor type, and the stage, whether or not it's a early stage versus a later stage, making sure that the biomarkers that are necessary for treatment are performed immediately at the time of diagnosis, if appropriate. So if it's in a late stage patient, that's where the biomarkers become important, because at that point, surgery is unlikely to potentially cure the patient. So you're talking about chemotherapy to try to extend the patient's survival. So you want to know all the options. In that case, okay, we know what the biomarkers are necessary in order to figure out guideline-based treatment. We know what they are, but it requires a sorted approach within the hospital, within the laboratory, within the pathology department, and basically everybody's got to be working to know what are the appropriate biomarkers, what is the stage of this patient, and agree upon with the oncologist and the pathologist that if I see a stage 4 lung cancer, here's what I'm going to do. If I see a stage 4 colorectal cancer, here's what I'm going to do. And so that's being implemented, but it's still, early days. A lot of times it gets, divided between multiple different laboratories. And this is where, yes, we get the information back, but it's in a variety of formats. And it's confusing for the oncologist to find it. It also causes delays. It ends up in lots of different tabs in the electronic medical record where things can be missed. It's just each step adds to potentially some of the delays and confusion with this. So again, the pathways approach seems to be one of the best, where a hospital and health system will, in a coordinated way, work with potentially their laboratory or pathology partners to determine for particular common disease states in an advanced stage, how are we going to do this? Are we going to do it, a few of the biomarkers locally in-house and then send it off? Are we going to just basically send the molecular markers off to a laboratory that can get it back to us within like 7 days? Or are we going to have a next generation sequencing panel in our own hospital? And a lot of those decisions are going to be based upon the volume of patients that come through that hospital and health system. It's also going to depend on sort of the local medical community as to which components are done where. What's key is this kind of navigation approach of the tissue, and an agreed upon protocol by the medical community, meaning the pathologist, the biopsying physician, and the medical oncologist, to sort of say, this is what we do when we've got this. This is the only way we're going to get the tissue back or the answers back in a timely manner.